Hello everyone, I'm Dr. Roza Olyai, obstetrician and gynecologist. I would like to talk about some points regarding irregular periods, irregular menses, and its relationship with infertility. So a lot of patients come to us and often they have their cycles. The first question we asked any infertile patient is whether your menstrual cycle is regular or not. Because one of the reasons why they're not getting pregnant is because their menstrual cycle is irregular. With that, I mean to say that, instead of having 28-day cycle, the cycles go either too early or the cycles go beyond 28 days. It goes to 40 days, sometimes even 60 days. So the most important factor is ovulation here. By ovulation, I mean to say the eggs, the ovaries which are here by the side of the uterus, they don't provide you egg. You're not ovulating every month, whereas which you should actually, with the effect of estrogen and the progesterone hormones, if they are into balance, automatically the whole orchestrated, hormonal orchestra will be working and you should be getting your menstrual period. But suppose there's not enough of these hormones, for example, estrogen, progesterone, or there is excess of any one of them, then the cycle gets disturbed and you land up in having periods of amenorrhea. So you will not be getting your menses on time. It'll be extended to 1 month, 2 months. So it's very important for you to go to your gynecologist at the earliest sign that your menstrual cycle is becoming irregular. For a month or so, it's okay. Usually due to stress, due to, strenuous exercises, you may be, having these problems of irregular cycles. However, as such, your menstrual cycle plays a big role in you getting fertile later on. So after marriage, for those couples who are planning to get pregnant, you must make sure that your cycles are regular, because during certain period of time mid-cycle, you will be ovulating, and that's a time you should be having sexual contact with your partners. So knowing the cycle is very important, and because I have seen sometimes patients, girls who ignore this. They, especially during the premarital counseling, I come across a lot of girls, who complain about this problem. It's very simple. There are certain hormonal treatments which can be given, and I would say that it's always good to take care of the issue, before you get married. And as soon as you get married, it's always good not to delay your first pregnancy, especially with irregular cycles. Some of the hormonal factors could also be related to thyroid. So we have this hypothyroidism, which usually lands up in having irregular cycles. Patients, put on a little weight. Your weight could be another factor which you have to be careful with. If you have a high BMI, certainly you land up to having, for having more irregular cycles. In my previous videos, I've talked about PCOD, that's polycystic ovarian disease, and how it leads to infertility. So do visit the video and go through it. You'll understand it a little more detail. So this was a very common question I was coming across in my clinic, that most often this is asked that, ladies ignore, young girls ignore it. And also, of course, at later on stages of life, let's say if you're 45 and above, which is called the premenopausal stage of women's life, one's menses gets irregular, which is very often very common. So that's not a worry question for us. The only thing is, if it's related to the reproductive years of your life, when you want to get pregnant, we are more worried about that. And I hope this video can help you to understand your cycle. In my previous videos, I've also talked about the regular cycles and the length of the cycle that it should be. Wish you all the best. Take care.